Welcome back to the deep dive. Today we're zeroing in on lens dislocation.
That's right.
Basically, when the eye's lens isn't quite where it should be, we've got the revision notes here, and our mission, as always, is to give you that high-yield info, make it stick for revision.
Absolutely. So lens dislocation, it's the partial or sometimes complete shift of the lens from its normal position.
Like it's come loose.
Exactly. Think of the lens inside your eye moving off-center. Usually this happens because of, well, a few main things. Trauma is a big one, or it could be genetics, or issues with connective tissues in the body.
Okay, let's unpack those causes a bit more. The etiology, what are the key players?
Right. So eye injuries, significant ones, are a common trigger. Then you've got the genetic side conditions like Marfan syndrome, Ehlers-Danlos, homocystinuria. Those are important ones to
Oh,
note.
what classic associations.
Yeah. And sometimes it's just a general weakness in the connective tissues or maybe other eye conditions already present. There's a handy mnemonic, actually. TGOC. Teaching trauma, genetics, ocular conditions, connective tissue. Helps cover the main bases.
Nice. Useful for recall.
And what's quite interesting, with Marfan's, the lens often shifts upwards, but with homocystinuria, it tends to go downwards.
Oh, that directionality is a good clinical clue. So, thinking about TGOC, who's most at risk?
Well, it follows directly from the causes, really. So anyone with a history of significant eye trauma,
Makes sense.
and definitely individuals with those known genetic connective tissue disorders we mentioned. Also, sometimes previous eye surgery can, inadvertently weaken things.
Right.
Yeah.
So, fundamentally, what's actually going wrong inside the eye? The pathophysiology bit.
Okay, so the key structures are the zonular fibers. You can think of them as tiny, like, ligaments or suspension cables holding the lens in place.
Holding it steady.
Exactly. In lens dislocation, these fibers are either weakened, stretched, or they actually break. Trauma can tear them directly.
Physical force.
Yep. And genetic mutations, like in Marfan's, affect the proteins that make up these fibers, making them inherently weaker or more brittle. Connective tissue disorders do something similar.
So the support fails.
Pretty much. And when that support system gives way, the lens moves, and that's what causes the visual problems. Blurriness, changes in focus, that sort of thing.
Okay, so if someone comes in with blurry vision, maybe double vision, what else should be on our minds? The differentials.
Good question. You definitely need to rule out other serious things. Retinal detachment is a big one.
Always an emergency.
Absolutely. Also, bleeding inside the eye, like a vitreous hemorrhage or a posterior vitreous detachment, which is more common, especially with age. And other structural problems in the eye need consideration, too.
Got it. And how often do we actually see lens dislocation? What's the epidemiology like, say, in the UK?
Specific UK prevalence data is a bit hard to pin down, honestly. It's generally considered a rare condition.
So not common.
Not common day-to-day, no. But it's crucial to remember that strong link with the underlying genetic conditions and connective tissue disorders. That's often where you'll encounter it.
Right. So what would a patient actually tell us? What are the common symptoms, the clinical features?
They'll often complain about blurred or maybe distorted vision. Double vision diplopia is quite common too.
Seeing double.
Yeah. Or just a noticeable change in how sharp their vision is. Some people become much more sensitive to light photophobia, and there might be some eye pain or general discomfort. Sometimes you might even be able to see the edge of the dislocated lens.
Wow, okay. So how do we confirm the diagnosis? What investigations are done?
It starts with a really thorough eye exam, so checking visual acuity, of course. Then a detailed look with a slit lamp, that's the microscope doctors use to examine the front of the eye.
Standard eye check tools.
Exactly. And a dilated fundus exam is essential to get a good look at the back of the eye and assess the lens properly. Sometimes imaging helps too.
Like what kind of imaging?
Ultrasound of the eye, or maybe OCT, that's optical coherence tomography. It gives really detailed cross-sectional images, helps pinpoint the lens position, and check for other damage.
Okay, so once it's diagnosed, what's the plan? How's lens dislocation managed?
Well, it really depends. You have to consider the cause, how severe the dislocation is, and crucially, how much it's impacting the patient's vision.
Tailored approach.
Definitely. Sometimes just updating glasses or trying special contact lenses can be enough, at least initially. But often, surgery is needed.
To fix it properly.
Yeah, either to reposition the existing lens if possible, or more commonly, to remove the dislocated lens and often replace it with an artificial one. And importantly, if there's an underlying genetic issue like Marfan's, managing that systemic condition is key too.
Right, the bigger picture. What about the long term? What's the prognosis?
It's quite variable. It really hinges on the underlying cause, the extent of the dislocation, and critically, how quickly effective treatment is started.
Early intervention helps.
Massively. Timely treatment can often restore good vision and prevent complications down the line. But it's not always straightforward. Some degree of visual impairment can persist and complications can still occur.
Okay, which brings us to complications. What are the main risks if lens dislocation isn't managed well, or even despite treatment?
Several potential problems. Glaucoma raised pressure inside the eye is a significant risk.
Pressure damage.
Exactly. Retinal detachment is another serious one we mentioned. Cataracts can develop. And just ongoing visual disturbances can be an issue. Plus, particularly in those genetic cases, the lens can dislocate again later on.
Recurrence risk.
Yes. So it really underscores why catching it early and getting the right management plan in place is so important.
Absolutely. Okay, let's do a super quick recap for revision. Lens dislocation. Lens out of place. Causes. Remember TGOC, trauma, genetics, ocular, connective tissue. Risks, injury, genetic conditions. Pathophysiology, weak or broken zonular fibers. Symptoms, blurred double vision. Diagnosis.eye exam, maybe imaging like OCT. Management lenses or often surgery, treat underlying cause. Prognosis.variable, better with early treatment. Complications, glaucoma, retinal detachment, cataracts.
Nicely summarized.
Right. Here's a final thought to mull over. Given the strong genetic links we've discussed, how might future advances, perhaps in gene therapy, change how we approach managing inherited forms of lens dislocation down the road? Something to think about. For more MSRA revision help, don't forget to check out pastMSRA.com and freeSRA.com.
Great resources.
Thanks for joining us for this deep dive.